On the day of discharge, you will be focused on, let's go home. While we do our best to help you accomplish your discharge efficiently, it is important for you to know that there are many processes that must be completed before you can go home. The staff must be sure you have a 30-day supply of medications before you are discharged. Your inpatient lab tests are completed, the lab tests for your first outpatient clinic appointment are prepared, and that your follow-up appointments to the clinic are made. The staff must review discharge instructions with you prior to your departure. Patients who travel long distances to get home may want to stay in a local hotel the night of discharge, since discharges may occur late in the afternoon or early evening. Patients should make plans to have someone stay with them to provide around-the-clock support for the first weeks after going home. Recipients will return to the clinic for their first appointment after surgery within a few days after discharge and will visit the clinic weekly for the first 6 weeks. Each recipient will have an individualized clinic visit schedule based on their needs after the first 6 weeks. Blood draws will need to be done twice weekly for the first 3 months after discharge. The total surgical recovery period is 6 to 8 weeks. Recipients will need to plan transportation to their lab and clinic appointments during the surgical recovery period. In order to diagnose rejection of the transplant before irreparable damage occurs, we do frequent biopsies in the first year following transplant. A biopsy will be performed in the operating room at the time of transplant and then at 3, 6, and 12 months after transplant. A biopsy requires a needle puncture in the area of the transplanted kidney. It is important for patients to understand that we are bound by the regulations set forth in the Health Insurance Portability and Accountability Act, or HIPAA. We cannot share your medical information with anyone without your express written permission. We cannot tell your spouse, father, mother, sister, brother, daughter, son, friend, or neighbor anything. We cannot answer any questions from the donor about the recipient. We cannot answer any question from the recipient about the donor. If you want us to be able to talk about your medical care with another person, you need to sign an authorization that we will keep on file. You are not listed on the day of your evaluation. You will only be listed when you have completed all the requested testing, your case has been reviewed by the Transplant Evaluation Committee, and it has determined you meet all the criteria for listing. You will know you are listed when you receive a letter from your coordinator informing you the committee has made the decision to list. You should receive a letter within 2 weeks of the evaluation meeting stating what the next steps are. If you do not, please contact your transplant coordinator. Your patient education guide includes a listing of the key players and their telephone numbers. Many support groups are available and some are listed in the patient education guide. The United Network for Organ Sharing provides a toll-free patient services line to help transplant candidates, recipients, and their family members understand organ allocation practices and transplantation data. You may also call this number to discuss a problem you may be experiencing with your transplant center or the transplantation system in general. This concludes our presentation on kidney transplantation. If you have any questions, please contact us at the phone numbers listed on screen. Thank you for considering kidney transplantation at the University of Michigan Transplant Center.